I'm Chris's mother. Chris will be 7 in 4 days. We started mild hyperbaric oxygen therapy in April of 2006, this year. We just completed our 64th dive consisting of 1-hour sessions just yesterday. And since we have started with the mild hyperbaric oxygen therapy, we have seen some significant improvements in Christopher's oral, motor, fine motor, and awareness, self-awareness, which has been very promising and very exciting. Chris is apraxic, so in the past we may get half a breathy word. It may have been mixed around. We're starting to see more complete words, more difficult sound combinations. He still is breathy, but we're seeing some nice gains in those areas, and some stringing of words now, some very simple sentences. Chris still needs to be motivated to say those things, but we know he's capable of them. And I think to a certain degree the onus is probably on us to make his life a little harder to get him moving along. But we have seen his ability to perform and speak more clearly. We've also seen improvement with fine motor. We've started the Handwriting Without Tears program, and he's starting to hold a pencil or marker properly, whereas before he couldn't do that, had no idea what was expected of him. He also is cutting with scissors now, real scissors, small ones, and it is starting to stabilize with one hand, cut properly with the scissors. He couldn't do that prior to starting the hyperbaric oxygen therapy, so we've seen some nice fine motor gains and oral motor gains that really came on when we started this therapy. We've also seen some nice self-awareness. If he gets food on his face or spills something on himself, he will clear his face or try and clear his shirt. He spilled water on himself the other day and looked at me and said, "Water." And I said, "Yeah, it's okay, you're okay." And then he was fine, looking to me to make sure that was okay. So more of that seeking approval, knowing that this isn't quite, what we want here, but, before he wouldn't have cared, and that just wasn't something that was important to him. "I don't want water, do you?" He's getting very opinionated with his choices, though, and we have seen an increase in his self-assertiveness, if that's a nice way to put it. So we're working, and he's doing very well with understanding, first we have to do this, then we'll do that, or you can't have that right now, we'll do that later. So even though we've seen an increase in him trying to advance his cause, he's also learning to wait and cope with that. With the toilet training, he has been trained about a year, although it's been more me prompting him continually. Since we've started the hyperbaric oxygen therapy, we've noticed that he has started to take care of himself without our assistance all the time, which has been, a nice thing to see after, working for a year, hoping that self-awareness and that independence would start to emerge, and it is. That happened about after our 30th dive. We have seen an increase in attention span. So far we've seen, oh, you dropped that, didn't you? Can you get that for me? Thank you. Thank you. Right, it's dirty though. Give it to me now. We've seen some nice improvements. We've seen, he's also categorizing objects now. There's greater letter and number recognition. He seems to be recognizing some basic sight words like I see or I hear, I want. And we are working on some basic reading and communication skills in case speech isn't something he ever attains. You know, we all feel pretty confident at this point that he will be able to use an augmentative device that has words instead of pictures. He's picking up those skills quite quickly. So far we've seen some very promising gains that, you know, we're hopeful will lead to his further improvement and enjoyment of life, really.